Today I will be demonstrating IV medication administration. I've already drawn up the correct medication, fentanyl 1 milligram per 1 ml, in the medication room using my 3 checks. I do have my medication now ready to go to see the patient, so it is labeled with the date and time along with the dosage, expiration date. I also have my flushes ready to go. So we're going to go ahead and see the patient. So I'm going to go ahead and knock. Hello, Mr. Sunbum. My name is Aristea Cavazos. I'm your nurse today. First thing I'm going to do is go ahead and wash my hands. If you could please tell me your name and date of birth. Mr. Sunbum, date of birth, 12/3/75. Compare that to my electronic record and his bracelet. Okay, 12/3/75. The doctor had ordered some pain medication for you. He said you were in pain. Can you tell me your pain level on a scale from 0 to 10? 7 out of 10. Okay, and any allergies to medication? No. Okay, so the first thing we want to go ahead and do is check his IV site. We want to make sure that there's no redness, swelling, any signs of phlebitis or infiltration, which he has none. Very good. And you said your pain was 7 out of 10. Okay, so this medication they're going to give you may make you a little bit drowsy. So we do ask that you stay in bed. If you do need anything, just give us a call with the call bell and we'll come and help you, okay? Very good, thank you. Okay, so I have my medication. I'm gonna go ahead and just wash my hands again real quick. And then I'm gonna do one last and final check. So it's fentanyl, 1 milligram per ml. Look it up under my record, fentanyl 1 milligram per ml, very good. Okay, so the first thing I'm gonna do is go ahead and I would put my gloves on. I'm gonna unclamp the port. I'm gonna remove the port cover. Get an alcohol swab. And I'm going to clean the port for 15 seconds. I'm gonna go ahead and let it dry. And then I'm going to get my flush. Now there's actually nothing in here because there's nowhere to go, but it's simulation. I would pull back for some air and then push up until I see the fluid come out of the top. So now that that's dried, I'm going to go ahead and connect my flush. And I'm going to go ahead and flush with 2 mLs. And there's no resistance. Okay, so I'm going to go ahead and remove my flush. I'm going to wipe my port again for 15 seconds, let it dry. Now I'm going to go ahead and get my medication. I already did my last check at the bedside. Make sure it is primed to the top. I'm going to go ahead and connect my medication. And so the fentanyl, we're going to give 0.5 milligrams over 1 minute. So I'm going to do 0.5 slowly. So I've given him the 0.5 milligrams. I'm gonna let him rest for a minute. So a minute has elapsed. I'm gonna do the next 0.5 milligrams. Are you feeling okay? Good. Okay, so I'm gonna go ahead and wait a minute. While I'm waiting a minute, I'm going to clean the port for 15 seconds. So my minute has elapsed and my port has dried. So I'm going to reconnect my flush. I'm going to go ahead and flush with 2 more mLs of normal saline, slowly. Okay, disconnect my flush, clean my port again, and I'm going to recap and close the HEP loop. Now, if the patient was on an IV, so we have Mr. Sunbum on an IV. I've already done my 3 medication checks in the medication room. I have my medication ready to go. I have already identified the patient using the 2 patient identifiers. No allergies to medication. Pain level 7 out of 10. And I have my medication ready to go. it is already labeled. So this is a compatible medication. So what I would go ahead and do, I don't need to stop the pump because it is compatible. So I want the port closest to the patient, so I have my port ready to go. I've already washed my hands, identified the patient, no allergies to medication. So I'm going to go ahead and get an alcohol swab, clean the port for 15 seconds, let it dry, and do one final check for my medication. Fentanyl 1.1 milligram per ml, fentanyl 1 milligram per ml. Very good. So then I have my flush. I've taken my cap off my flush. Make sure a little bit of fluid comes out of the top. I'm going to go ahead and place that in my port. And I'm going to flush it with 4 milligrams of normal saline. Okay, remove that. And then I'm going to clean my port again for 15 seconds. Let it dry. Now I have my medication ready to go. Make sure it's primed to the top. Put it in. And I'm going to inject slowly, 0.5 ml. And then I'm going to wait a minute. So the minute has passed. And then I'm going to inject the next 0.5 ml slowly. Okay. I'm going to go ahead and wait a minute. So as I'm waiting for a minute, I'm going to go ahead and clean my port again. And I'm going to let that dry. So that is dried. I'm going to get my flush solution, place it back on, and flush with 4 more mLs of normal saline. Okay, remove my flush and clean my port once again. And then I will ask my patient his pain level. What is your pain level now? 3 out of 10? Okay, very good. So now we are getting to do IV medication, but it is a non-compatible solution. So for the non-compatible solution, we do need to pause the machine. So we're going to go ahead and pause the machine. I've already assessed pain. I've assessed the IV site, allergies to medication. I've identified the patient using 2 patient identifiers. I've also washed my hands and, excuse me, made sure to verify the electronic record. So the same thing, the machine has been paused. So I want to go ahead and pinch a little here. And I have my port. I have my clean alcohol. And this is a non-compatible solution. So I'm going to clean my port for 15 seconds. And let that dry. So once that has dried, I take the cap off my flush. I'm going to draw back a little bit and push up to get the fluid off the top. Okay, that is dried. So this time, because it is non-compatible, we are going to flush with 10 mLs of normal saline. So I still have the tubing pinched at the top above, right here. So I've connected my flush. I'm going to go ahead and flush 10 mLs. I've already done my flush, so my next step is to clean my port for 15 seconds and let that dry. So that is dry. Then I'm going to go ahead and get my solution, my medication. Just prime it a little bit to the top. Place it in here. I still have the top pinched, and so I'm going to inject 0.5 mL slowly. And then wait a minute. The minute has passed. Do another 0.5 mL slowly. And then wait a minute. the minute has passed. So I'm going to go ahead and clean my port again. I'm going to flush with a new 10 ml syringe, take the cap off, pull it back to the top, connect it, and I'm going to flush with 10 mLs. Can go ahead and release this, take my flush off, clean my port, and restart my IV. So if the patient has a central venous access and we need to give a medication, the first thing we want to do is, the medication has already been drawn up in the medication room. I've done my 3 checks. I have my medication out here labeled and ready to go, along with the 2 flushes that I'm going to need for the injection. I've already washed my hands, identified the patient, pain level 6 out of 10, no allergies to medication. So the next thing we want to do is go ahead and check his site to make sure that there's no redness, discharge, swelling, any inflammation, any signs of infection. He has none. There's no mottling, no JVD. So it's not boggy, so it looks good. So we're gonna go ahead and administer the medication through his portacap. So the first thing I wanna just go ahead and unclamp it. My clamp came off. So we unclamp it, remove the cap, and then I've already washed my hands and have my gloves on. I'm gonna go ahead and clean it with alcohol. So I'm cleaning my port for 15 seconds, letting it dry. I have my 10 ml flush. So I'm gonna put my flush in, and this has already been primed. Put my flush in. I'm gonna draw back. There's some blood return. You don't want the blood going into the flush. So then I'm going to go ahead and flush with 10 mLs. So I went ahead and flushed it. Are you feeling okay? Good. So then clean my port again. Get my medication, which is my 3rd and final check. Well, my last check here at the bedside. Make sure it's primed to the top. Connect my medication. And I'm going to inject 0.5 slowly. And then I'm going to wait a minute. And then I'm going to inject 0.5 mLs slowly. So this is done slowly, and that's done. And while I'm waiting a minute, I'm gonna go ahead and clean my port for 15 seconds and let it dry. And then I'm going to get my final syringe of 10 ml flush to flush the catheter with slowly. Are you feeling okay? Good. So I went ahead and did my flush. Once again, I'm going to clean my port and cover my port. And these are the 4 demonstrations for IV medication administration. After the first IV medication administration, I did verbalize that the patient was identified using 2 patient identifiers. Medications were drawn up in the medication room using 3 checks. The patient was also asked about pain level as well as allergies to medication. Thank you.